Guys, welcome. This is very important learning video on medical coding. Many students want to make medical coding as a career. However, they do not have full insight on this topic. Therefore, we have created this video to help you to choose your career wisely. In this video, we will learn today So let me set a background so you understand medical coding very well. We all go to doctor when we are ill. In India, 95% of the doctor have physical paper which has a medical history, symptoms, treatment and procedure of the patient. If patient shift from one state to another state, patient has to carry all the papers in case patient want to refer to another doctor. Also, if patient has insurance, patient or hospital have to submit all medical records to the insurance company for processing claim. We all have experienced this in day-to-day life. But what happened in the developed country like USA? When patient visit to doctor first time, medical record number is created and all the medical history, treatment, diagnosis can be tracked by your medical record number throughout the life. In this case, if patient shift to any states of USA, the treating physician can get all information by MRN number. Every patient in the US has a medical insurance, and when patient visit to a doctor, bill is paid by insurance company. Insurance company need this data in a numeric code to process the claim and pay the biller. Now what is medical coding? Let us learn with this example. Say a patient sleep on the floor and have excruciating pain, you have taken him to hospital for treatment. Patient explains symptoms like severe pain and swelling. Doctor makes medical examination. Doctor advises some medical investigation like X-rays and MRI and found that bone is broken. He gives you medicine and performs some procedure to fix the bone, and if required, you are hospitalized. All these events of diagnosis, treatment, procedures are captured in hospital paper as a medical record. Your treatment is completed and doctor found you well and you leave for home. These medical records get converted into a numeric codes through medical coding. This patient has insurance and now the biller need to be paid for the medical services for doctor consultation, diagnostic procedures, medicines and hospitalization bill. To pay the biller, insurance company need all data in a numeric. Therefore, medical coding is when a professional translates the medical reports containing symptoms, procedures, diagnosis and medication into universally accepted code. For example, diagnosis code for a broken femur is S72.301A. Hope you have now fair understanding about medical coding. Now consider one patient visit to hospital once in a year and there are 5 terms to be coded. According to Center of Disease Control, that is CDC, there were over 1.4 billion patients visit in 1 year. So considering 5 terms, there could be 7 billion codes to be coded every year. And this is massive. That is why medical coding has a great future. Now let us learn more about the codes. In medical coding, there are 3 main sets of code. First code, called as current procedure terminology, that is CPT code. This is a procedural code developed by American Medical Association which describes medical, surgical and diagnostic services. CPT codes are of 5-digit codes that are divided into 3 categories. The first category is used most often and it is divided into 6 ranges. These ranges corresponds to 6 major medical fields like evaluation and management, anesthesia, surgery, radiology, pathology, laboratory and medicine. The second category of CPT code corresponds to performance measurement, and in some cases, laboratory and radiology tests as well. The third category of CPT codes corresponds to emerging medical technology. Now, the second most important in the coding is Healthcare Common Procedure Coding System, is also called as HCPCS. Now, these are set of codes based on CPT code. HCPCS codes primarily corresponds to service, procedures, and equipment not covered by the CPT code. These include durable medical equipment, it could be prosthetics, ambulance ride, and certain drugs and medicine. And the third most important within the medical coding is your ICD-10 CM codes. These are diagnosis codes that describe the disease, injury, and other health condition of the patient. ICD code decide medical necessity. Why pursue medical coding as a career? Medical coder is a rewarding and fulfilling career as it provides flexible working hours, high demand, competitive salary, and a flexible training program. Now let's learn what are the software used for medical coding. Now let us learn the next topic, that is medical coding certification. You can also prepare for an industry recognized certification exam like Certified Professional Coder, that is CPC exam. It costs you around 28,000 rupees and exams are of 4 hours. Some institute that offers preparations are like Academy of Medical Coding of India, Metro America Medical Coding and Billing, etc. Now, very interesting topic. Let us see what is the job outlook of medical coding. Medical coding is one of the fastest growing job in healthcare industry today. As per US Bureau of Labor Statistics, the employment for medical records and health information technician, which includes the medical biller and coders, are expected to increase by 15% by 2024, faster than the average rate of all occupations. As a medical coder, you should possess skill like attention to details, communication skill, organizational skills, analytical skill, a very ethical attitude, and a very important is a computer skill because you will be working majorly on the computer. And last but not least is understanding about the medical terminology. Now here comes the last part which you are most interested. That is medical coding salary in India. In India, the average annual salary of a medical coder is approximately 3.75 lakhs per annum. The medical coding salary for a fresh graduate is 3,20,000 per annum. The scope of an experienced medical coding professional is high as the average salary can be around between 15 to 8 lakhs. I have also given a comparison of medical coding salary in a different country compared to India. This was the full video on medical coding. I hope this has given you a good perspective in case you are thinking to start medical coding as a career. If you like this video, please subscribe to our channel. Stay connected through our YouTube page as well as Telegram. We are available to help you to find your first job. Thank you for watching the video.